Hello, NEET PG aspirants and those preparing for the NEET PG 2021 and AIMS and PGI May session. This is Dr. Pavan, and I'm your surgery mentor on an academy. And I welcome you all to the image-based questions with mentors on general surgery in today's image-based marathon. First and foremost, I want to apologize to you because I cannot join you live because of some reason. So that's the reason I'm recording this particular video with you. But please don't go anywhere. Stay with me. You will have to get to know a couple of things. And what I've done today is I have put up around 6 MCQs, which are the image-based questions. So it is just a kind of icebreaker between us. We will go through it in a fun manner in next 15-20 minutes, and I will try to add some value to whatever the topics I'm covering through these MCQs. And towards the end of the session, what I have planned is I will be talking to you about an academy. Why? Because I want that you should understand this particular platform. This is like reasonably a new platform. We have launched in, let's say, around October, and we have prepared students for the NEET 2020. We organized a medical marathon, which was very much welcomed by the students. And I just want that all the students who are trying to prepare for the NEET 2021 should at least know about this platform and what are we trying to do on this platform. And then they can decide with themselves that do they want to join with this and make us their companion in preparing for the NEET 2021. So let us begin. First and foremost, let us begin and let us talk about a couple of image-based questions which I have put up in this particular session. Now, so the first question which we have is, what is the manual which has been shown in this particular image? So what you have here, you have an image of, this is basically an intra-abdominal image, and what you are seeing here is, you are seeing that there is a surgeon who is trying to cut the intestine from this particular end, and okay, so he's putting up an incision over here, and then he's lifting up these intestine and moving it towards the medial side. Now, what is this maneuver and why it is done? So whenever you read general surgery, I have made a couple of videos like how to approach general surgery and all those things. You can have a look about that. So how to approach this particular question? So what is the surgeon trying to do? He's trying to put up an incision and then moving the intestine on the medial side. So what is this particular maneuver? So is it a Cattle-Black manure? It is a Mattox manure? Is it a Prentice manure? Or it is a Pringles manure? So the answer to this particular question is, in fact, it is a Cattle-Black manure. Okay, right. So what is Cattle-Black manure? This is basically the right medial rotation of the intestine. Now, why you need to do it? Because if at all you want to operate on any of the retroperitoneal structures, let's say intestine, or more importantly, the vascular structures. What are the vascular structures which are towards the right side? So I hope you see this. This is basically the aorta. So if you have aortic aneurysm or you have a rent in the aorta or something and you to operate over it, you cannot just approach the aorta. You have to reach to the aorta first. So how do you reach it? By performing a Cattle-Black maneuver, that is by moving these particular intestines on the medial side. So this is a Cattle-Black maneuver. A very simple way to remember this is, whenever you were in the school or maybe in the college also, every class has what? Every class has a class representative. So what I have noticed that many students have a kind of confusion between Cattle-Black manure and the Mattox manure. So if you remember this, so Cattle-Black manure is basically the right medial rotation. So you will be able to remember it like this. Okay, so Mattox manure is basically the left medial rotation, right? Okay, so yeah, this is how you can kind of remember it. So this is basically a Cattle-Black manure. Now if you see towards this, so this is basically the Mattox manure, and it is a, if at all the similar kind of a thing is performed on the left side, if at all you perform this, what you will gain access to? You will gain access to this. What is this? This is, okay, so I'm really sorry. Yeah, so in the particular question which I was trying to tell you, this is basically the inferior vena cava. Okay, so by performing a Cattle-Black maneuver, what you gain access? You gain access to the inferior vena cava. Obviously on the right side, what do you have? You have the inferior vena cava, but on the left side, what do you have? You have the aorta. So you gain access to the aorta by performing the Mattox maneuver. Please understand this. Okay, so on the right, when you perform a Cattle-Black maneuver, you gain access to the inferior vena cava and the renal vessels and all those things and the kidneys. And when you perform the Mattox maneuver, you gain access to the aorta. Please understand this. Okay, so okay, now why are we cutting it from this particular thing? So what is this? There is a concept of white line of Told. So what is this white line of told? This is basically the avascular plane. So if you cut along this plane, what will happen? The bleeding will not occur and you will easily be able to lift all the intestines without compromising their vascular supply. So this is again important. What is this white line of told? This is basically the avascular plane through which you cut these particular mesentery. Okay, so I hope you understood this. Now, the third option was Prentice maneuver. Many of the students wouldn't have heard about this. What is this? So it's a bit detailed, not necessarily essential to know, but as you have joined us, so I just want to convey it to you. So what is this Prentice maneuver? So this is a maneuver which is an intraoperative maneuver which you perform while operating in the patients of kind of undescended testes. So what you all know, what is undescended testes? That is, the testes is in the intra-abdominal cavity, and while you're performing a surgery, one of the important surgeries is the Stephen Fowler technique. So what you do is you pull the testes down and you put it in the scrotum. Now, testes is supplied by the testicular artery. So if you just pull that testes and pull it and attach it to the scrotum, what will happen? The vascular supply of the testes can be hampered. So what you do is you perform this Prentice maneuver. So what is this Prentice maneuver? It helps you in knowing whether the length of the testicular artery is good enough to come and supply it to the scrotum. So what you do is, for example, if you have a undescended testes of a right side, so once you have isolated the testes and you have isolated the mesentery, you try to pull it towards the left deep inguinal ring. So if the testes can be negotiated towards the opposite deep inguinal ring, then it means that the length of that particular testicular artery is good enough and it can supply the testes even in the scrotum. So at the max, what you can remember is Prentice maneuver is something which you performed intraoperatively while performing the surgery of the undescended testes, that is the orchidopexy. I hope you understood it. Okay, and the last one, what you have a Pringles maneuver. Now this is a very, very famous maneuver which I'm sure most of you must be aware of. So what is a Pringles maneuver? So it is a technique in which you compress the hepatico-duodenal ligament. So what is a hepatico-duodenal ligament? It is a ligament which joins the like the lower border of the liver with the first part of the duodenum. Now what is a characteristic feature of this? The characteristic feature is it has a portal triad. So what is a portal triad in this? So you have this common bile duct, then you have the portal vein, and then you have the hepatic artery. Okay, so I hope you understood this. So you have a okay, so this is a portal triad. So if you compress this, what will happen? The entire inflow towards the liver will stop. So if the entire inflow to the liver stops, what will happen? So when is this particular maneuver performed? So this maneuver is performed in whenever you are operating a patient for a liver trauma. So in the liver trauma, if you perform a Pringles maneuver and the bleeding from the liver stops, what does this signify? This signifies that the source of the bleed is either the hepatic artery or the portal vein. But if the bleeding continues, what does it signify? It signifies that the source of the bleed is hepatic vein. So this is the reason why you perform a Pringles maneuver in the liver trauma patients. It's a very, very famous maneuver and you have to know this. Okay, so this is basically a Pringles maneuver, and what you're compressing is a hepatico-duodenal ligament. That's it. Okay, right. So moving on to the next particular question. Right, a patient was brought to the casualty when he experienced a instant loss of erection while having a sexual intercourse, and he heard a snapping sound. What is the diagnosis? And the image of the penis has been shown to you. Okay, so is the patient suffering from the urethral injury, dorsal artery of the penis rupture, penile fracture, or a priapism? So what do you think is the answer? Just put it down in the comments. What do you think is the answer? So answer to this particular question is in fact a penile fracture, and this is a very, very characteristic clinical scenario which you will get if at all you get a patient of a penile fracture. Now you all know what you have in the penis. You have the corpora cavernosa and you have a corpora spongiosa. So you have two corpora cavernosa and the one corpora spongiosa. From the corpora spongiosum, what travels is the urethra, and the corpora cavernosa, these are the vascular sinusoids, and they get filled up and they are engorged, and this is something which leads to the erection. Now during the sexual intercourse, obviously the corpora cavernosa will be engorged with blood, and if at all there is a lateral bending of the penis, so sometimes what can happen, the tunica albuginea can rupture. So if at all it kind of suffers from a rent, what will happen? The erection will be lost, and this is something what is called as a penile fracture. So what is a penile fracture? This is basically the rupture or a rent in the tunica albuginea. It usually occurs when there is a erect penis and whenever there is a lateral bending of the penis. Okay, so I hope you understood this. So this is basically a penile fracture. So this particular image is of penile fracture, and there was a question on this in the recent JIPMER exam. Okay, so this is not something very common. It's a very rare case. It's one of the rare cases, and many of the students wouldn't have seen a actual case of this particular patient. But yes, this is how a penile fracture presents to you. Now, a characteristic image which can be shown to you is a typical kind of finding which we get in a penile fracture is eggplant deformity. So what do we get? We get a eggplant deformity. So what is this eggplant? Eggplant is basically the brinjal shaped penis. Okay, so eggplant is the brinjal. So the penis attains a shape of a brinjal. So two kind of appearance which you can get with a penile fracture is, one is the eggplant deformity, that is the brinjal shaped penis, or you can get a S shaped penis. Okay, so here the penis is somewhat like an S shaped. So yes, we get a S shaped penis. Please understand this. Okay, so these two things are associated with penile kind of fracture, and this eggplant deformity, this is a very characteristic thing which is associated with the penile fracture. Please make a note of it. Okay, right. So moving on to the next particular question is, a patient after an upper GI endoscopy developed crepitations on palpation of the neck, and the surgeon offered an X-ray, and the X-ray has been shown to you. So you are having a look at the X-ray, and after basically an upper GI endoscopy, the patient developed a crepitations on the palpation. So what is this particular thing very much suggestive of? It is suggestive of subcutaneous emphysema. Okay, so after upper GI endoscopy, the patient developed a subcutaneous emphysema, and the surgeon has ordered this particular X-ray. What is kind of the diagnosis? So is it a esophageal rupture, the rib fracture, pneumothorax, or a kind of a pneumoperitoneum? So please understand, what is this? Again, a very simple question. That is basically an esophageal rupture. Okay, so what is this? This is basically a esophageal rupture. Please understand this. I'll just talk a bit about it. So this is basically an esophageal rupture which you are getting over here. So what you are having here, you are having a subcutaneous emphysema, and this is a esophageal rupture. Now, why do you get an esophageal rupture during an upper GI endoscopy? So upper GI endoscopy, that is an iatrogenic cause, that is the most common cause of an esophageal rupture. How do you get it? So whenever you negotiate your scope through the cricoesophageal junction, this is in fact the narrowest part of the entire GIT, and when you negotiate your scope through it, there is a chance that you may cause a rent in the esophagus, and this is what is a esophageal rupture. This is how the esophageal rupture develops as an iatrogenic cause, and this is the most common cause. Please understand it. And one of the important signs which you might get in the clinical scenario is this subcutaneous emphysema. Now, if you just have a look at this particular X-ray, what are you seeing over here? So I hope you can appreciate, this is your thoracic cavity, and you find this haziness between the skin and the ribs. So what is this? This is again an X-ray finding of a subcutaneous emphysema. And another very characteristic sign which you can get in here is it related to any leaf? Can you please tell me what is the sign? It is called as a ginkgo leaf sign. Okay, so what is it called as a? It is called as a ginkgo leaf sign. So this is basically a leaf of a particular plant, that is a ginkgo plant. And if you have an X-ray of a patient who is suffering from this, you can have this ginkgo leaf sign. So what happens? The air accumulates along the fibers of the pectoralis muscle, and this gives rise a characteristic ginkgo leaf sign. Okay, so I hope you could appreciate this. This is a ginkgo leaf, and the air which is kind of accumulating along the fibers of the pectoralis major muscle, this gives rise to a ginkgo leaf sign. I hope you understand this. Okay, so this is our third question which I wanted to talk to you about. Okay, so let's move on to the next particular question. Right, so a patient is a chronic alcoholic and comes to you with a severe pain in the epigastric region. The CT scan of the patient has been shown to you. What is the diagnosis of this particular patient? So here you have a patient who is a chronic alcoholic and comes to you with a severe epigastric pain, and the CT scan has been shown to you. So again, whenever you are preparing for any of the exams, you should have a rough idea about how the things look on the CT scan. So this is basically a CT scan. So first thing which you need to understand is it a CT or an MRI? So it is a CT scan. How to kind of recognize it? Just have a look at the bones. So this is the vertebra, which is a white in color. So obviously it is a CT scan. So this is basically your liver. This is your kidney, that is the right kidney. This is your left kidney. This is your aorta. And what is this? This here, somewhere over here, this is your pancreas. And I hope you can appreciate this white colored thing, which is spread over here. So this is basically a calcification which shouldn't be present over here. So this is a calcifications in the parenchyma of the pancreas. Okay, so I hope you understood this. So this is basically a patient who is suffering from a chronic pancreatitis. Okay, so please understand this. This is not an acute pancreatitis. This is a chronic pancreatitis. In the acute pancreatitis, calcification and the atrophic pancreas is not a very common finding. But a calcified atrophic pancreatic parenchyma, it is a very characteristic feature of a chronic pancreatitis. I hope you understood it. Okay. Now this is not a very difficult question, but it such kind of questions are asked and it can be asked to you, and also they can show you an x-ray of a patient. Now this is not again a very common x-ray. So here what you have a patient on x-ray. You can appreciate this calcification along the pancreas. So if at all they give any clinical scenario and then they give you this kind of an x-ray, this is again indicative of a chronic pancreatitis. I hope you understand it. Okay, so please understand this is also a patient who is suffering from a chronic pancreatitis. I hope you understood it. Okay, right. So moving on to the next particular question. So identify the investigation which has been shown in this particular image. So this is your image which has been shown to you, and is the patient, are we trying to show you a flexible colonoscopy, capsule endoscopy, virtual colonoscopy, or a reconstructed MRI? Okay, so just have a look at it and just comment on the comment box what is the answer of this particular question. So in this particular question, what we are trying to tell you is this is basically a virtual colonoscopy. Okay, so what is this? This is a virtual colonoscopy. Now this is not a flexible colonoscopy. So what do you understand by a flexible colonoscopy? So in which you put in a scope and you actually visualize the inside of the lumen of the colon. Okay, so that is what you understand by a actual flexible colonoscopy. Now capsule endoscopy, this is a kind of a small endoscope which a very capsule sized endoscope which the patient eats and it passes through the entire GI tract, and we can have images. That is a capsule endoscopy. Now what is this? This is basically a virtual colonoscopy. So what do you understand by virtual colonoscopy? So this is basically a 3D reconstructed CT scan of the patient. Now if at all you have taken up a CT scan, nowadays you can 3D reconstruct it, and if you 3D reconstruct the CT scan of the colon, you get an image like this, and this can be asked to you. Now there are certain advantages of a flexible colonoscopy and there are certain advantages of the virtual colonoscopy. So what are the certain advantages of the flexible colonoscopy? The basic and the fundamental advantage of the flexible colonoscopy is you can take up a biopsy. For example, in this particular patient, you are having a look at the polyp, and if you find it during the flexible endoscopy, you can always perform a polypectomy and you can take it out. So this is something which you can do in the flexible colonoscopy, but you cannot do it in a virtual colonoscopy, because in the virtual colonoscopy you're not putting up any instrument. This is basically a reconstructed format of it. So in the virtual colonoscopy, what is the advantage? So what is the advantage of virtual colonoscopy over the conventional flexible colonoscopy? So the basic advantage is, by performing a virtual colonoscopy, you can have a look at inside the lumen, and also you can have a look at outside the lumen at the same time. So if at all you have any doubt whether there is an indentation, whether the stricture, or is there any mass which is present which is compressing on the intestine or something like that, you can always have a look at the CT scan of the patient, and you can also have a look at the external of the lumen. So in the virtual colonoscopy, you can have a fair amount of idea what is present inside the lumen and what is present outside the lumen in the same investigation. But in the flexible colonoscopy, you can only have a look inside the lumen. You cannot assess outside the lumen. You will have to perform a CT scan for that. Okay, so these are the basic things, the nitty-gritty of the things, but you need to understand the drawback of virtual colonoscopy is no biopsy possible, but the advantage is you can have a look at outside the lumen. Okay, so I hope you understood it. This is again an important kind of a thing which I just wanted to share it with you, right? Okay, so moving on to the next particular question. A patient after the head injury has been brought to the hospital. The CT scan of the patient was done, and we got the following image. What is the diagnosis of this particular patient? So this is a patient of a head injury and it has been brought to the hospital, and you have done a CT scan. So is it an acute SDH, that is a subdural hemorrhage? Is it a chronic SDH? Is it an EDH or a subarachnoid hemorrhage? Now again, this is a bit of a kind of a off the track question, a very simple question, but touching a bit detail of it. So please understand what is it. This is basically a chronic SDH. This is not an acute SDH. Now, please understand one thing. Now, you all must be knowing what is the investigation of choice of a head injury. The investigation of choice for head injury is non-contrast enhanced CT scan of the brain. Now, the basic question is, why do you perform a non-contrast CT of the brain? So the basic reason why you perform a non-contrast CT of the brain while diagnosing a head injury is to understand, if you understand a basic fact that the acute blood, if at all there is a acute bleeding inside the brain, it will look white on the CT scan. Okay, so if you know this particular fact, you will know why do we perform a non-contrast CT scan. Because if you perform a contrast enhanced CT scan, and if at all there is an acute hemorrhage also, your contrast and the acute hemorrhage will mix with each other, and you will not be able to distinguish whether the white region which you are seeing, is it because of the contrast or is it because of the acute blood which has been extravasated. Okay, so this is the reason why you perform a non-contrast CT scan of the brain in order to diagnose any head injury. Now, in this particular patient, you have done a CT scan, but what you're seeing over here is there is a lesion over here. Okay, so there is a crescent-shaped lesion over here, but the entire lesion is not homogeneous. Okay, so why the entire lesion is not homogeneous? Because the lower part of the crescent, if you look, it is a bit more whiter, and the upper part of the crescent is a bit more black. And then you have a brain parenchyma which has been shifted towards it. Now, you all must be knowing this. A banana shaped opacity or a concave or convex shaped opacity, this is a characteristic feature of a subdural hemorrhage. So no doubt it is not an extradural hemorrhage, it is not a subarachnoid hemorrhage, it is a subdural hemorrhage. Now, why it is a chronic subdural hemorrhage? Because the entire crescent shaped opacity, it is not homogeneous, it is a heterogeneous opacity. In the lower part of the crescent you see a whitish kind of a thing, in the upper part of the crescent you see a blackish kind of a thing. So it indicates that the blood is not a acute blood, it has been there for a couple of days or maybe a week or a 10 days or so. So if at all this is a particular thing, this points towards the chronic subdural hemorrhage. Now, who are the patients who suffer from the chronic subdural hemorrhage? So the elderly patients, after the trivial trauma, they don't deteriorate immediately. They deteriorate after 15-20 days or something. And these are the patients whom you refer to as a suffering from a chronic subdural hemorrhage. I hope you understand it. Okay, so please see at this particular image, this is a image of a chronic subdural hemorrhage. And if at all somebody asks you what is the investigation of choice to diagnose a chronic subdural hemorrhage, so the investigation of choice to diagnose a chronic subdural hemorrhage is an MRI. You don't perform a CT scan in order to diagnose it. Okay, so this is a CT scan, but if at all somebody asks you what is the investigation of choice to diagnose a chronic subdural hemorrhage, specifically chronic subdural hemorrhage, then your answer would be MRI. Okay, so these were the 6 questions which I had today for you. So I was not trying to make any point out of it. I'm just trying to tell you like how exactly the image based questions can be asked. They were not a very difficult questions. I just tried to convey a couple of points which I wanted to convey to you. So yeah, I hope I added some value to whatever you have listened till now. Now, another thing which I want to tell you is I want to introduce you to the Unacademy platform as I see it. So how do I look at Unacademy platform? Now, before around 2014, the only modality of learning which was available was face-to-face learning. Okay, so you go to a center and you attend a class and then you come back, the educator is there, he or she teaches you for let's say 3 or 5 days or something, and then the educator goes back and then you come home and you read for yourself. This was the only method available till 2014. After that, some kind of recorded app-based lectures did come up, and now we have come up with something which is called as a really apologizing for this. So now we have come up with a live online teaching. So this is basically a live online teaching which we are performing on the Unacademy platform. Okay, just give me a 1 minute, guys. Okay, so actually I'm a bit traveling. That's the reason I couldn't take up a live class, and that's why I'm recording. So just stay with me for a couple of minutes. I'll just introduce you to the platform of Unacademy, and then we'll move on. Really sorry. Okay, so just stay focused. Okay, so what do we have? I'm not trying to endorse anything, I'm just trying to lay down the facts for you. So we have a face-to-face lectures, we have app-based lectures, and we have a live lectures. So these are the, on the first column what I've put up are the features which any student might look for whenever he or she considers anything as a support for preparing for the NEET PG or AIMS or PGI or whatever exam. So the key points to look at is interactive sessions, time-bound sessions, flexibility, class material, freedom to revisit the sessions, and the cost. So what about the interactive sessions? So please understand, if you attend any live to live class, so those are interactive sessions, no doubt, but at the same time there are around 200 students sitting in the class and there is a one educator who is teaching on the platform. So the sessions are interactive, but more or less it is a one-way teaching, like this educator is trying to put in the thoughts and you are basically grasping it and putting it on the notes. If you have any nitty-gritty doubt, you're not able to ask him directly because you are sitting in a class of 200 or 300 students or something like that. Now, this particular factor is completely absent in the app-based lectures. During the lecture, you cannot ask the educator any doubts. But here, on Unacademy platform, what we do, we perform a live online classes. So at any point you can stop us, you can ask us any doubt. If you don't understand, you can ask us to repeat or something like that. You can do that. You can definitely do that, no doubt about it. Now, what about the time bound sessions? Now, one of the major drawbacks of the app based recorded lessons was it was not an interactive session, and that is the reason why, if at all you ask most of the students, they did not complete all the apps which they took. If at all you ask your seniors, around 90-95% of the students will tell you that whatever the apps they took, they were not able to see the entire videos or the entire duration of the videos on the app. One of the major reasons for this is the lessons are not interactive. Right. Now, what about the time bound sessions? And another drawback of the app based classes is they are not time bound. So what happens every time the student has in the back of their mind that they have the lectures with us and they can watch them anytime they want. But in the face-to-face classes, what happens? You have to go there, you have to sit there from morning to night, and then you attend the less sessions. But there is a drawback of that also, because towards the end of the session, you are kind of drained out and you are not feeling, you're just sitting there and taking down the notes, but you're not grasping a lot. Now, what we are planning to do on the live online classes is these are also going to be a time bound session. So for example, the foundation batch, it is going to be a time bound session. It is going to be every day from kind of 9 to 12:30. So there will be 9 to 10:30, then half an hour break, and then from 11 to 12:30 there will be a second session. So 3 years of teaching every day, and that will be only 3 years of session, so that you can maintain your kind of attention in that particular span. Now let's talk about the flexibility. The major drawback about the face-to-face classes is it is not flexible. For example, if you are caught up in some emergency duty or something like that, you may not be able to attend the face-to-face session and that educator has gone. You will never be able to read from that educator firsthand. Okay, this is the first drawback. Now, what about the app-based recorded lectures? This is something where the app-based recorded lectures are good because they are flexible. If at all somebody can maintain their dedication, they're sincere enough, they can definitely go to the recorded sessions and they can have a look at that. The mentor is there, the recorded material is there, they can have a look at that. And the same thing is also present in the live online classes. If at all due to some reason you have your emergency duty or something and you miss the session, our session will be present in the recorded format for you to revisit. So you can definitely revisit that particular session. So the kind of the live online sessions which we are conducting, they are live as well as they will be available as a recorded format for you anytime whenever you want to revisit them. What about the class material? So well, in the face-to-face sessions, you take down the notes, whatever they kind of the educators try to tell it to you. And in the app-based recorded lectures, many of the apps have come up with the structured notes. That is a good thing. You can go through those notes. That's completely fine. What we do on the live online classes at Unacademy is at the end of the session, whatever the PPTs which we have used in order to teach you, they are available for you in a recorded and a downloadable format. So I mean, you can download them with annotations and without annotations. You can do that. That's completely fine, and you can refer that to kind of revise the topic which we have covered. And at the same time, we are in the process of making the structured notes and they will be available to you very, very soon. So we will also be providing the structured notes for all the subjects on the foundation course. Lastly, about freedom to revisit the sessions, I've already talked about it. In the face-to-face classes, you cannot do that. In the app-based sessions, yes, you can. And in the live online classes, yes, you can revisit. If at all you miss a particular class, you can revisit it. Now, what about the cost? So face-to-face classes, they are expensive. They're not cheap, okay? They're expensive, but there is a logistics behind it. They have to pay for the auditorium, they have to pay for the educators to travel to that particular place and everything. So yes, they are expensive. The app-based recorded sessions, they are also expensive, and they're not very expensive. They're kind of in a moderate range. And the live online classes which we are conducting over here, they're also a moderate to low range. Okay, so yes, you can have a look at that. I will be talking about that at the end of the session. Now, right. So how to navigate through the Unacademy? Some of the students have a bit issue with it. I'll just walk you through it in 1 minute. So just go to the unacademy.com page. And whenever you go to the unacademy.com page, just go over here and explore me. Just select the NEET PG wala thing. Okay, so if you scroll down, you will be having a look. These are all the courses which are available. These are all the exams for which the Unacademy prepares. But you and me, we are the medicos. So we are kind of eyeing towards the NEET PG exam. So just go there and have a look at the NEET PG section, click it over that, and you will be brought to this particular thing. So just put in your kind of phone number and you will get registered. You can do that using your Google or a Facebook account. Once you're registered, you will be brought to this particular page, and then this is basically the free page of NEET PG thing. You have to click on this plus symbol. So whenever you click on the plus symbol, again you have to go there and you have to select the NEET PG option over here. And once you select this, you will be brought to the plus page of the Unacademy platform, and here you can have a look at it. Okay, so this is basically the plus platform wala page. In this you will find all the educators which are there. You will find all the courses and all the classes which we are conducting. Right, so this is about how to navigate through the Unacademy website, because a couple of students have a bit issue with that. Now lastly, I'll be talking about what are the courses available on the Unacademy platform. So how are we kind of trying to help you? So most of the kind of classes or whatever the app-based recorded lectures, there are one set of videos and you have to watch them and you have to modify your study material, or you have to study techniques related to it. On our Unacademy platform, what we are trying to do is all these are the things which you will be having access to. So the first thing is the free special classes. So we conduct the free special classes and the free YouTube sessions. Even if you have not taken up any of our Plus subscription, you will have access to this particular thing. So these are the things, even if you have not paid us anything, you will be having access to the free special classes and the free YouTube sessions. Now, from the batch courses till the medical marathon, this will be available for the students who have taken up our paid subscription. So what about the batch courses? Please understand one thing. So what is a batch course? So for example, this is one of the batch course which we are launching. Okay, so this is basically a batch course. Okay, so this is the foundation course which we are all here to talk about. So all the 20 educators which are coming on this particular platform, this YouTube image-based marathon, are the teachers of the foundation course for the NEET PG. Okay, so in this is a batch course, and as I've told you, in a batch course, none of the sessions will be repeated. So don't worry about that anatomy video will be overlapping with the physiology or a biochemistry or something like that. There will be no overlap between any of the subject within a batch course. So different courses can overlap, but one particular batch course will not overlap. Okay, so this is a foundation course which is the main course for the NEET 2021. None of the sessions in this particular batch course will be overlapping. Be rest assured. You can go to the page and you can have a look at the schedule. So this foundation course, this is starting in the end of January and it will continue till November, like first week of November or something, and your entire course will be completed. You have the schedule of the entire year on that particular page. Just go there and you can have a look at it. And if you are aiming towards the NIMHANS exam, so this is basically an integrated batch course which is again launching on like 29th of January. In this, all the educators will be talking about the central nervous system kind of a thing. So this is a uniqueness of Unacademy. We don't just give you a one particular thing, but we also give you multiple formats of a same thing. So you can have a look at that, you can browse through them, and whatever suits you the best, you can have a look at it. Okay, so this is about the batch course. These are the few of the batch courses, and we will be launching many more among like in the coming days. Okay, so this was the first thing, which is the batch course, and I have also talked about the foundation course. Now this is basically my page, and as you can see, I have launched up a detailed course on urology for the AIIMS and PGI 2020. This was launched on 25th of January, and then there is a detailed course on the hepatobiliary system on the AIIMS and PGI. This will be starting on 27th of January. So this is basically the small courses which I'm launching, and I will be covering the entire general surgery before your AIIMS and PGI, and each and every educator is trying to do the same. So not only there is a foundation course, but there are also multiple small courses. For example, in general surgery, you don't have any issues with the urology, so you can skip that particular session. And if you just want to read the hepatobiliary system, you can come and attend those 6 sessions and you'll be through with it. Okay, so this is how you can use an academy. So each and every educator is doing the same thing. If you just go to the page, you will be having a look at it. So we are launching simultaneously, we are also launching lots of small courses. You can take advantage of that. Okay, right. Now these were the my page, those were the my individual courses. So at this moment I have published only two, but very shortly I'll be publishing all the courses. So be rest assured there will be multiple short courses which will be available for you before AIIMS and PGI. Right. Now, this was my individual courses, but at the same time, there are individual courses which are launched by each and every educator. So these are all the educators. You can go on the page, you can have a look at it. These are the individual courses launched by all the educators. So these are the first year subjects, these are the second year subjects, and these are the pre-final and the final year subjects. You can have a look at them. Okay. Right. So I have talked to you about how an academy works. So if at all you take up a subscription, you will not have access only to a foundation course, but you will have access to all the videos published by any educator on the platform, or any of the batch course, any of the thing which is published on the particular platform related to the NEET PG. Now, we are also in the process of launching the test series and the Q bank, which will be available very soon. And we are also in the process of making the structured notes. So all these things will be available to you within 20-25 days or something. So you can be rest assured every possible support will be given to you. And the advantage of this particular platform is we will be coming live practically every day till your NEET 2021. So if you have any doubt, you can just come online and you can ask us and you get your doubts cleared then and there. Okay, so these are the features about the Unacademy thing which I just wanted to convey to you. I'm not trying to say you that just come here and join an academy and that is the best thing ever. I'm just trying to explain what we are offering over here, because we'll be very happy to connect with you and help you walk you through the NEET PG preparation. Okay, so I'll be more than happy to connect with you, and if at all you feel that we will be able to help you, please come and join. We'll be more than happy to connect with you. Right. Now the last and the most one of the important thing is, what about the fees? So it's very reasonable, guys. If you take up a 6-month subscription, you will get the entire 6-month subscription in 18,000, and if you take up like the 12-month subscription, you will get it in 22.5 thousand. And this will be possible if you use a promo code drpavan hyphen YT. Okay, so /YT. So if you use this particular promo code, you will get 10% off. The actual price for the 6-month subscription is 20k, and for the 12-month subscription is 25k. If you use the promo code, you will get 10% off. So prices will be slashed down to 22.5k and 18k. Right. And the uniqueness about this is you will not have access to only the individual courses or the batch courses or something like that. You will have access to all the videos and all the courses published on the platform during the entire time. And last thing which I forgot to tell you was the medical marathon. So last year we launched the medical marathon just before the NEET PG, and it was very much welcomed by all the students. So what is this medical marathon? It is basically a crash course which we conducted just before the NEET PG. So in the medical marathon, what we will be doing is every educator will be coming online simultaneously on the subsequent days, and will be revising the entire general surgery. Last year I came online and revised the entire general surgery in 10 days. So many students actually really welcome the medical marathon. You can have a word with them also. So if you take up a 1-year subscription, you will have access to this also, because we are planning to do this at the end of this particular session also. So you got the point. If you take up a subscription, you will get entire thing: foundation course, small courses targeting the AIIMS and PGI, and all the other batch courses, and many other things which we are planning to bring on the platform. Okay, so I've made my point, and I hope you understood it. If you have any doubts, please do put up in the comment section. I will be referring it to it very soon, and I apologize to you one more time. Due to my personal reasons, I couldn't come online live on the YouTube platform, and that is the reason I'm recording this particular video for you. Thank you so much. I hope it was helpful to you. I hope a bit of a value was added to your life because of this. So I'm really looking forward to connect with you on our free platform, that is the special classes, as well as on the plus platform on the AIMS and PGI sessions and the foundation batches. Okay, so I'll be really happy to connect with you there, and I hope to see you there. Okay, so please go on the link below and you will be directed towards my page. You can have a look at all the courses, all the kind of small courses which we're launching, and please follow me. I'll be more than happy if you follow me on an academy platform. It will be really good to have you as my follower. So you will also have all the notifications of all the videos which will be uploaded over a period of time. Okay, so thank you so much for joining with me today, and have a great day. Happy studying, guys. This is Pawan Kandhari signing off. See you soon. Bye.